Hello, everyone. Welcome to Dental Board's Reviews. And today we're going to review a prevention of infective endocarditis for dental procedures. Okay, so these are updated guidelines. And if you haven't subscribed already to this channel, make sure you subscribe, click the notification bell so you can receive notifications for any new reviews which are posted. Okay, all right. So, antibiotic prophylaxis for dental procedures is reasonable, okay, only for the patients with the highest risk for poor outcomes from IE. IE is infective endocarditis, okay? So, only those patients with the highest risk, and we're going to look at the patients with the highest risk. So, if the patient has increased risk of IE, but they don't have the highest risk, you don't have to prophylax. Okay, so routine administration of antibiotics for patients who are at risk of infective endocarditis prior to dental procedures is not recommended. So you are not supposed to routinely provide prophylaxis, okay, antibiotic prophylaxis to patients who have like a history of cardiac issues. They have all these things. If they don't have the highest risks which are going to be mentioned, you don't have to prophylax. Okay. Now, again, you have to use your clinical judgment based on other systemic factors for the patient too. Okay. So whether those factors are well controlled or not. So really, here they're telling you reserve the antibiotics for the highest risk of patients who can have adverse outcomes, okay, when they get infective endocarditis. Now, so prophylaxis should only be reserved for those patients with cardiac conditions with the highest risk. Okay, so keep that in mind. So antibiotic prophylaxis is reasonable before dental procedures that involve manipulation of the gingival tissues, manipulation of the perioral regions, okay, extractions, perforation of the oral mucosa in patients, okay, in patients who have valvular heart disease, okay, with the following conditions. So, patient may have valvular heart diseases, okay, such as mitral valve regurgitation, aortic regurgitation. So those are not the ones they're talking about. Okay, they're talking about valvular heart disease with the following conditions. So let's look at what conditions that they recommend to prophylax. They haven't really changed much. So what has changed so far is mostly the sequence of antibiotics. Okay, so as we know already, so it's patients with these patients you're supposed to prophylax. Okay, you're supposed to prophylax these patients. Okay, so this list here, make sure you know it, who to prophylax. Patient comes in for dental treatment. If you are going to be doing a deep cleaning, okay, extraction of a tooth, probing, because you'll be probing deeply and manipulating the tissues. If they have these conditions, you're supposed to give antibiotic prophylaxis 30 to 60 minutes prior to the procedure. So, prosthetic cardiac valves, okay? So, prosthetic cardiac valves. And those patients with a prosthetic material, okay, for cardiac valve repair. So, if they tell you they have had a prosthetic cardiac valve repair, make sure just go ahead and prophylax for precaution. And those people who have a history of previous infective endocarditis, okay? Now, patients who come in with a cyanotic congenital heart defect, okay, whether it's repaired or unrepaired, go ahead and prophylax. Now, when it's repaired, they're talking about if there's some sort of regurgitation, so leakage between the prosthetic patch. Make sure you prophylax. Now, you may not know by talking to the patient about this. So, but if you see repaired, okay, congenital heart defect, you can prophylax. All right. Now, for those who are taking dental boards or exams in your dental school, just make sure you know these guidelines, okay, and know what to answer, okay. So those patients with cardiac transplants with valve regurgitation, so cardiac transplant, the patient tells you there's a cardiac transplant, you prophylax. Now, this is going to be mostly for specialists, okay. Most patients and those in the hospital. So most patients with cardiac transplants are most going to be seen in the hospitals because the community dentists are going to be to shy away from treating these patients, and most of these patients find themselves in the hospitals. Okay. All right. So make sure you memorize this list. It's a short list, okay, of the patients you're supposed to prophylax. Give antibiotics 30 to 60 minutes before your dental treatment. Whether it's probing, scaling and root planning, extractions. Okay, so whenever you're deeply manipulating the gingival tissues, so soft tissues. Okay, so antibiotic prophylaxis is not recommended for these dental procedures. Routine anesthetic injections in non-infected tissues, taking radiographs, placement of prosthetics, okay, so prosthetics or orthodontic appliances, or if you're adjusting an orthodontic appliance, placement of orthodontic brackets, shedding of deciduous teeth, so removing deciduous teeth, or bleeding through from the trauma of the lips or oral mucosa. So if you see this, you don't have to, for patients who have a risk of, so they have a risk of infective endocarditis, but they don't have the highest risk. Okay, remember the patients with the highest risk are those patients with are those patients with either they have a heart valve replacement, or whether they have a history of endocarditis, okay, or they have a congenital heart defect, or they've had a prosthetic patch, okay. So make sure you know those conditions. Those are the highest risk. If anyone else has a, deemed to be, you think that they may have infective endocarditis, you don't have to prophylax. But so if you ask an exam, those are what you have to do. But clinically, it's going to depend on the practitioner. All right. So here's a list, okay, of antibiotics that you can use and the recommended dosages. All right. So you give the single dose 30 to 60 minutes. Okay. Give the single dose 30 to 6 minutes before the procedure. So let's add an E here. Okay. So these are all taken orally. Okay, so you can give them in your dental office. You don't have to start an IV before you can give it. So you give it orally, PO. Okay. Now, the one we know, if the patient is not allergic to penicillins, the best one is amoxicillin. You give 2 grams, okay, 30 minutes before the procedure, or 60 minutes before the procedure. So it's about 30. So you have to, the least amount of time you can wait is 30 minutes. Okay, so for it to be available in the blood already. And for children, you give 50 milligrams per kg per kilogram. Okay. Now, if the patients are unable to take oral medications, you can have ampicillin. Okay. Now, this one is going to be, you can have an injections through intramuscular, so IM, or intravenous, IV. So 2 grams also. All right. So if it's a penicillin family, so amoxicillin and ampicillins are penicillin families, you're going to give 2 grams. The difference is going to be the route of administration. Okay. So, and then for children, it's 50 milligrams per kilogram. All right. Now, or you can give cephalosporins such as cefazolin or ceftriaxone. Okay, and these are 1 gram IM or IV. Now, when you give them IM or IV, you don't give them fast. Okay, so you give them slowly to prevent any anaphylaxis. Okay. Now, if the patient is allergic to penicillin, or ampicillin, so penicillins in general, they have removed clindamycin. Okay, so clindamycin is no longer recommended for usage in prophylaxis for infective endocarditis during dental procedure. Okay, so you can see now you can use cephalosporins such as cephalexin, which is Keflex, and you can give Keflex or cephalexin 2 grams. Okay, give it 2 grams by mouth 30 minutes before your procedure. Okay, and in children it's 50 milligrams per kg. Okay, or you can give macrolides such as azithromycin and clarithromycin. Okay, remember I mentioned in the previous videos in terms of antibiotics. Okay, that these are good medications also. So you give 500 milligrams. Okay, so it's a smaller dosage. So you can see for the penicillins and the cephalosporins, you're giving 2 grams, right? So 1 to 2 grams. But when it comes to macrolides, you're giving 500 milligrams in adults. 500 milligrams, you give it 30 minutes before you start your procedure. Okay? So if you have a hygienist who's treating these patients, okay, make sure you remind them to prophylax. Okay? And then also 15 milligrams per kg in children. Doxycycline, most people shy away from doxycycline, but doxycycline is a tetracycline. It's a very good antibiotic. Okay, and most periodontists actually they like to use this. Okay, as intramuscular medication. All right, but doxycycline, okay, you can use that if the patient has allergies to penicillins, and you give 100 milligrams. Okay, and of course, in children, you have to be aware of doxycycline. Okay, staining if they're developing the teeth, but you have to look at the weight. So if they're less than 45 kg, you do 2.2 milligrams per kg. If they're more than 45 kilograms, then you go ahead and give them like an adult 100 milligrams. Okay, so if they are less than 45 kg, you give them 2.2 milligrams per kg. If the child weight is more than 45 kilograms kg, you go ahead and give 100 milligrams. Okay, so if they are allergic to penicillin or ampicillin and unable to take oral medication, so some patients will come in and they are not able to take anything orally for certain reasons. So you could go ahead and give ceftriaxone or cefazolin 1 gram IM or IV. Okay, and for children it's 50 milligrams per kg. So make sure you know this chart. Okay, so it can help you and you can order this medication for your office. And for those taking board exams, make sure you review and know what to give. Clindamycin again is not what you jump on when somebody is allergic to medication to penicillin. Okay, so true or false? Clindamycin is no longer recommended for antibiotic prophylaxis for dental procedures. That is true. Okay, so remember that. And now, cephalosporin, if somebody is allergic to cephalosporin, to penicillin, you can give Keflex, which is a cephalexin. Now, it's a cephalosporin. Now, if they say that they've had anaphylaxis, anaphylaxis is different from a patient say, "Oh, I'm allergic to penicillin, but I only had like a headache. I had some stomach issues." That's different from anaphylaxis. Or they had angioedema, they had swelling. Okay, urticaria, they have these big, target lesions on their skin. Because rash to penicillin. So you don't give them cephalexin, okay, cephalosporin. So avoid cephalosporin for patients who say, "Oh no, I had my throat swelling, I had some lip swelling, I had a rash and all those things." Okay, try to avoid giving the cephalosporin. But if somebody says they just have adverse effects to penicillin, such as stomach issues, diarrhea, you can go ahead and give um, the cephalosporin, such as Keflex. Okay. All right. So for non-dental procedures, okay, patients who have a high risk of infective endocarditis and they are going to have a colonoscopy or they are going to have AGD, okay, so endoscopy, or they are having a transesophageal echo, okay, that's a TEE. So all these things do not require prophylaxis, all right? If there's no active infection. All right, so make sure you know your reviews of the antibiotics. Make sure you review you review the conditions of the highest risks, okay, that you're supposed to give antibiotics to prevent infective endocarditis. Okay, so make sure you subscribe and look out for more reviews. Okay, remember to comment, like, or share, or just go ahead and send me an email with any questions.